So that's what we've got on prior authorization and utilization management. And now for my favorite mouthful, going into the mid-year enrollee notification of unused supplemental benefits. Now you may say doesn't go into effect until the middle of 2026. I mean, it's January 26th. The communications have to be sent out between June 30th and July 31st. But I can tell you there's a lot that's needed here and to think through this process and the data that needs to be pulled in order to be able to solve for this. So if you have not begun solutioning for this to as quickly as possible get in place what you need, I would just highly recommend that this is an area of focus because it will be here before we know it. So what is this? This mid-year notification of unused supplemental benefits? This applies specifically, exclusively to Medicare Advantage plans. And what's the goal? There are a significant number of supplemental benefits that are added as part of Medicare Advantage plans, upwards of 23 for some, and almost all of the Medicare Advantage plans have some type of supplemental benefit that is offered. Right? These are benefits that are funded through their US tax dollars, and it's intended to be able to improve the individual's health. And one of the unfortunately, one of the facts is that they are very, very underutilized. And so CMS is requiring for all Medicare Advantage plans that offer supplemental benefits. So those are supplemental benefits, right? Range anything from dental and vision and hearing to meal delivery, transportation, the list goes on and on. They're requiring that a communication has to be sent annually between June 30th and July 31st to members who have completely not used that supplemental benefit. So, for example, if somebody did go to the dentist to get their teeth cleaned, they utilized some of that benefit. So you're not required to report on that one. However, any of the other ones, you've got to be able to pull the data to know that they have the supplemental benefit by member, that there has been zero utilization of that specific supplemental benefit, and that needs to be included on the notification that's sent between June 30th and July 31st. So this really helps to support the initiatives around transparency. It's a benefit that people are notified of, usually at the beginning of the year. They get their member card, they get their member information, benefits are described in there. But again, they go very, very underutilized. So this is a big requirement of being able to pull all of this data and send these letters out for any Medicare Advantage member who has not utilized any of these supplemental benefits. And so, getting on this right now as far as being able to pull the data, and then, finding the right partner to be able to help with the execution of it. So it just really supports the transparency and then helping members to really understand their benefits and how to use them and just overall aligning with value-based care, really, modeled by really connecting members to the benefits that help them improve their overall health outcome. So what are the implications of this one? I'm sure all of your minds are probably spinning on what this takes. There is a significant operations, and then tech from being able to pull and to access the data is probably going to be the most critical piece of this, of getting that data pulled timely and being able to be handled with to be multiple potential different formats for that, and then driving that outreach in a timely manner that happens again short time period, June 30th to July 31st, to demonstrate the compliance with it. So pretty big change, and notification that's coming here in 2026.